have analyzed a set of 46 patients with samples collected at baseline. What we did was to take a kind of standard diagnostic sample from the iliac crest and compared it to a sample collected from a focal lesion. So focal lesions are accumulations of malignant plasma cells at specific positions in the bone marrow. And we used next-generation sequencing to compare these two samples and saw heterogeneity in space in the majority of these samples. So at least 2/3 of all samples show extended heterogeneity in space on the nucleotide level. There are different predictors used for risk classification. Some are based on gene expression profiling, other on FISH data. And what we saw in an analysis of gene expression profiling data, that at least 10% of patients that would have been classified as low risk are actually high risk according to the paired sample. We also performed a survival analysis and could actually show that the sample with the higher risk classification is actually the one that drives prognosis. So, yeah, in conclusion, these data actually give us a hint why most of the risk predictors we're currently using in the field of myeloma have a very low sensitivity for high risk, just because there may be a heterogeneity in space also on the level of risk. We investigated a set of driver genes and target mutations in myeloma and could show that all of these driver genes may contain mutations only detected at specific sites in the body. That means if a sample is investigated just by chance that doesn't contain these mutations, that patient would actually not be identified as a case for targeted treatment. However, let's say a subclone is investigated that contains these mutations. A clinician may make the decision that just because this clone contains these mutations, that the patient would be a good candidate for a targeted treatment, although that targeted treatment actually really targets just this subclone in myeloma. Myeloma patients are not treated based on molecular data. That means even although there is heterogeneity in space, that won't influence the physician's choice of treatment. However, in the future, if we really want to perform targeted treatment of myeloma patients, one idea would be either to investigate multiple samples per patient or even use other sources of material. And this morning, a colleague of mine presented some data. He investigated circulating DNA and circulating tumor cells, and the idea would be that these material may actually be more representative for the heterogeneity in space in myeloma.